Hi, I will present the paper as it required in the guidelines of the conferences. My name is Gülten Eretkoçeri. I'm from Kosovo. I'm in the last year of the PhD study in Skopje in North Macedonia. The title of paper which I will present today is Professional Perception on Family-Centered Early Childhood Interventions for Children with Development Delays in Kosovo. The problem area and need for research in early childhood interventions. As we know, early childhood interventions is critical for lifelong learning, relationships, and development. Challenges in early childhood interventions is with development delays, thrive with support, yet barriers persist as limited trained professionals, lack of accessibility, family-centered services, and insufficient resources, especially in rural areas. The need for research. Family-centered approach proven to enhance outcomes but faces implementation challenges. The professional perspectives are essential for tailoring services to community needs, and in Kosovo context, we are in transition from medical to family-centered models, and the need for improved policies and trainings to ensure inclusive early childhood interventions. The inputs, efforts, and the methodology of the study. We did the study with 70 professionals which were working with children 0 to 6 years with developmental delays and disabilities. The higher proportion of the children were boys, especially 0 to 36 months, 28.54% of them, and predominantly were from urban area with 70.57%, with notable of rural representation with 29.42%. The family income of the children, for most of them, were from middle income with 85.93%, and from lower income were 7.10%, and the upper income were 6.95%. The efforts, the instruments which we used for the study, we adopted from UNICEF's methodological guide for national situation analysis on early childhood intervention, which were did by Vergas Baron et al. The focus of the study was to understanding professional perception and the process of the accessing early childhood intervention services. The methodology, we used the descriptive approach. We did collection with quantitative surveys from professionals, and the analysis highlights the distribution of service provision based on child's demographics and family backgrounds. Key findings on children served. 2.86% of children were children at risk situations. 27.77% of children were children with development delays, and 22.68% of children were children with disabilities. 25.81% were children with behavioral challenges, and 1.69% of children were children with mental health needs, and 19.16% of children were children with multiple delays and disability. The service intensity and frequency, 89.30% of children take the services 2 or more times in a week, and the duration of the service, For 19.59% of children reported 1 hour visit. The professional participation and trainings. The top fields in early childhood interventions were in speech and language therapy with 19.27%, in early childhood developmental with 18.07%, and early childhood intervention with 16.26%. Training, which take the professionals for 34.3% take under 10 hours per year trainings, and for 15.7% take the trainings over 41 hours of trainings per year. Preferred training formats were on professional conferences with 16.85% and continuous on-site trainings for 16.09% of them. Place when the child did the visits. For 84.93%, services do in the early childhood center or in hospitals, and for 10.50%, they did the visits in child care center or inclusive preschool, and for 0.70%, home of child, and for 3.85% in the community center or other places. The supervision which take the professionals were like this: coaching and mentoring for 35%, reflective supervision for 21%, and file reviews for 28%. The key gaps we identified were limited home-based services and need for family-centered approaches and professional trainings. Challenges and needs in early childhood intervention services. Stigma and lack of inclusion for 10.51%. These findings underscores the urgent need to foster community acceptance and inclusive practices for children with development delays and disabilities. Inadequate national service data for 9.90%, a lack of comprehensive data hampers effective planning and resource allocation. Policy and funding gaps. Challenges such as inadequate policies with 9.09% and insufficient funding for 9.30% reveal systemic barriers that require urgent governmental and organizational action. Rural accessibility for 6.30%. Difficulty in reaching families in remote and minority regions highlight geographic disparities in services provision. Recommendation for improving early childhood intervention services. Parenting education and support with 9.97%. This top recommendation highlights the critical needs for resources and programs to empower families. Advocacy against stigma with 9.18%. Promoting acceptance and reducing discrimination remain central goals. Accessibility and equality, expanding home visited services with 6.56%, and improving access to underserved areas with 6.29% emphasize the need for inclusive outreach. And the policy development with 5.77%. The call for national policy and systematic framework reflects the need for strategic governance. Key discussion points on early childhood intervention, challenges and insights. The complex needs of children, high overlap of developmental and behavioral issues, and socioeconomic barriers, such as middle-income families, which dominate, and lower-income families face access challenges. Services, frequency, and duration, weekly sessions, typically 1 hour, along with standard, and international changes, funding gaps, and rural disparities, which are studied also in the Montenegro, in Serbia, in Croatia, Georgia, and Ukraine, found the same problems. And the stigma, universal challenge impacting services uptake. Thank you.